Hello, everyone, and thank you so much for choosing to spend some time with us today. We are really excited to have you for this public webinar where we're going to be talking about increasing the amplitude of small movements and really helping you to improve fine motor skills using LSVT BIG. And sometimes people think of that as something that's sort of contradictory. How do we use LSVT BIG for things that are already very small and very fine? So we're going to figure that out today, and we'll spend some time really delving into that and figuring out, again, how we can impact that quality of life for you. So my name is Heather Cianci, and I am one of the organizers for today's webinar. I am a physical therapist by training, and I am joined by my colleague, Julia Wood, who is an occupational therapist. And both Julia and myself work at the Dan Aaron Parkinson's Rehab Center, which is part of Pennsylvania Hospital in Philadelphia, Pennsylvania. We have both been teaching for LSVT Global for a number of years and use this technique in our clinic and use it very successfully and really enjoy using it. So we hope that you will get a really good feeling from what we're able to impart to you today. So thank you again. We do have some disclosures that we'd like to share with you right now. All of the LSVT BIG faculty do have both financial and non-financial relationships with the organization of LSVT Global. Our non-financial relationship includes a preference for using LSVT BIG as a treatment technique. And financial relationships include that both myself and Julia are consultants of and receive lecture honorarium and travel reimbursement from LSVT Global. Our plan for this webinar is we'll go over a couple of the logistics for how we can make sure that this is a really fun, interactive time for all of us. Then Julia and I will break the presentation in half. I will the first part and Julia will take the second part, and we'll talk about all of the content. And then we'll make sure that we do have some time at the end to address any kind of questions or comments or concerns that you may have. We're also going to have a short survey, so please do take a moment at the conclusion of this webinar to give us your thoughts on how things went and to give us some ideas, perhaps on other topics that you would really like to hear about in the future. We can only grow better through you guys letting us know what you really want to learn about and how we can be there for you. So for those of you who are clinicians on this today, we'd like to let you know a little bit about how to report this CE activity. So LSVT Global Webinar is not ASHA or state registered for the CEUs for PT, OT, or speech professionals, but you can absolutely use these self-reported credits as a non-registered, non-pre-approved activity. If you are a PT, OT, or speech therapist and you would like to report your activity, what we'd ask you to do is to go ahead and email us at webinars@lsvtglobal.com and request that we send you a certificate after you've completed this webinar. And that certificate will include both your name, the date, and the duration of the webinar. We'd ask that you would attend for the full hour of this webinar. Remember that the licensing requirements do differ by each state, so you're going to want to check with your particular state licensing board and determine if you are able to use these CEUs. So let's talk a little bit about what you're going to learn today. What we're going to do, myself and Julia, is really work to give you examples of fine motor tasks and how Parkinson's disease actually impacts them. What are the changes that happen because of the symptoms of Parkinson's? Then we're going to talk about how do we use LSVT BIG to really address those difficulties with fine motor control. And we'll be doing that in part by going over an overview of what LSVT BIG is and how we would do that for you. We're going to identify some of the fine motor tasks that you would like to improve and then help you to get started with finding therapists who are certified in LSVT BIG and getting you into that treatment that could better help you. Our mission at LSVT Global is really to truly empower people with Parkinson's to restore and maintain their highest levels possible of functional communication, mobility, and independence in your daily life through our scientifically supported therapy programs. And that is not just LSVT BIG, which you are learning about today, but that also includes LSVT Loud, which is a program used by speech language pathologists to help people with Parkinson's disease and other neurological conditions. So let's break it down and talk about, what are we talking about when we say fine motor tasks? Really, what are they? Well, those fine motor tasks are really the things which require the precise manipulation of your hand and your fingers. And that's going to include steadiness, coordination, motor control of those muscles, proprioception, which means knowing where those muscles are in space, and sensation, that ability to feel hot and cold and pain and light touch and deep touch. All of those things are really critical to making sure that your movements are accurate and discrete. Examples of some of those fine motor tasks would be buttoning your clothes, writing, typing, tying your shoes, perhaps putting on jewelry, fastening anything from a really, really tiny earring to perhaps a necklace or a clasp, something on your watch, and even picking up small objects and grasping. One of the things that a lot of people will deal with and talk to both myself and Julia about are about the difficulty they have with controlling their handwriting and being able to actually read their handwriting. It is up to 75% of people with Parkinson's disease actually suffer from this, and this is called micrographia. That's that where you start to write something and then it tapers off and it gets very, very small and almost kind of scribbly to the point where you're not able to even kind of see what you were writing about. So even small movements with Parkinson's disease are too small. So we need to recognize that even though we call this big and we're talking about small things, the small things get smaller with Parkinson's. So we really do need to make the normally small things that get even more small bigger, and how we use LSVT BIG to do that. So right now we're going to start a polling question. So I am going to load the poll in just a moment. And the question is, if you have Parkinson's, if you're someone with Parkinson's right now who is listening to this webinar, have you experienced any difficulties or changes in your fine motor function? So let me go ahead and load that poll. And go ahead and answer those questions for me. I'm going to give everybody a few minutes. If you have Parkinson's disease, have you experienced any difficulties or changes in your fine motor function? Good. I'm going to give you about 10 more seconds here. Okay, great, everyone. So what we're seeing is almost what the research just said there, that almost 72% of you have said that you actually have problems with those fine motor function, just like we talked about in the previous slide, about 75% of people have difficulty with micrographia. Thank you so much for sharing that with us. That helps us to be able to kind of really focus in on this and give you some more insight. So let's talk a little bit about what is the cause of the fine motor control issues that individuals with Parkinson's disease are dealing with. One of them is limb kinetic apraxia. And what this means is that there's actually a loss of that deftness, so that control or that correct movement with the ability of a decrease in the ability to correctly perform independent but coordinated finger movements. So there's actually a loss of that ability to control that. There's also something called somatosensory processing deficits. And that means that the brain is not communicating well. Certain parts of the brain really have to play well with one another and read information from them. And we know that there are problems in the interplay between two particular parts in the brain there, the basal ganglia and the supplementary motor area. Now, the underlying basis really is not fully understood for this. So we don't have an exact answer to say why it is the case. We have ideas what's going on, And unfortunately, a lot of these issues with the fine motor coordination are not really sensitive to your dopaminergic therapy. So meaning that your carbidopa levodopa oftentimes doesn't really help you with those fine motor movements. The other problem with people who have difficulties with fine motor control is the bradykinesia. And we know that that is the slow movements. So those really slow movements, luckily, tend to be more responsive to dopamine therapy. So working with your therapist, along with a really good regimen of the best medications you can have, really can help with that slowness of movement. And that's where LSVT BIG comes in to help us engage those movements and really get them to be much bigger and much more intensive. There's also the problems with tremor that can really make it difficult for people to hold things, to grasp things, and to be able to coordinate movements, as well as a reduction in hand strength. And you can lose strength in your hand from underuse. So let's say that you're right-handed and your Parkinson's symptoms have started on your left side. Well, you know what? Because you're right-handed, you're overusing that right hand a lot, and you may not be engaging that left hand in enough of the activities. So when we underuse muscles, they actually become weaker. So with LSVT BIG, we really work on getting the whole body to be making these bigger movements so that we can, again, increase that quality of movement and functionality. So let's talk about a recent randomized controlled study. And this study looked at whether setting very specific goals would help to improve the effectiveness of therapy for people with Parkinson's disease. So what they wanted to do was evaluate the effects of a functional. So that means you're doing something, you're reaching for something, you're grabbing something. It's something functional. The effects of a functional client-centered intervention based on a specific set of goals compared to a standardized approach in patients with Parkinson's. And what they worked on in here was manual dexterity, the hand grip strength, and your finger prehension, so that use of those tips of the fingers and moving them together. And what they did was they found that when you're targeting therapy towards very specific goals, you actually get greater changes in the function of the arm. So that means if you really wanted to work on being able to button your buttons better, or you really wanted to be able to work on your handwriting better, you wouldn't necessarily just do strengthening exercises, or you might not do things where you're picking beans out of a bowl or working with therapy. And while those things can have some help with the strength and the mobility of the hand, what we're looking at is that people with Parkinson's disease actually show greater improvement in attaining their goals if their therapy is focused on a specific set of goals. And that means really working to function. So whatever the problem is you're having, we're going to address that specific problem through the use of LSVT BIG. Getting back to what we talked about before with micrographia, there has been some nice research looking in handwriting for people with Parkinson's disease. And this was called the relearning of writing skills in Parkinson's disease after intensive Amplitude training. And they looked at 38 people who were right-handed, and they broke those people into two groups. And then they worked for 30 minutes a day, 5 days a week for 6 weeks. So pretty substantial amount of time there. And they really worked on Amplitude training. So working on writing, making the writing bigger, making the writing more intense. And then the other group just worked on stretching and trying to relax. Now, what they found was that the group who actually worked on the Amplitude training found that their writing was a little more automatic, that it transferred to different areas, meaning they could write on the paper, they could write here, they could do cursive, they could do printing, and they were able to retain that increased writing size, meaning that they were able to actually diminish the micrographia after they worked on that intensive Amplitude training, where the folks who were just stretching the hands and working on relaxation really showed no improvement in that writing ability. So again, it goes back to the specificity of what we're doing. Whatever you're having trouble with, that's what we need to practice doing, and we need to do that with big amplitude and big intensity. So now we're going to take another moment for a polling question, and I will load this in just a moment, but let me read it to you. Again, if you are a person with Parkinson's disease or another neurological condition, we want to know, have you already received the LSVT BIG treatment? So let me go ahead and bring that next poll up. Good. And everyone, you can take a few moments there and go ahead and answer those polling questions for us. Again, really helps us to know who we're talking to. We're almost at a 50-50 split there. I'm going to give you a few more moments to go ahead and vote. Good. All right. Let's take a look here. So we're almost, again, at a 50-50 split there. So about half of the folks have already had LSVT BIG and half have not. So really, thank you to the people who have already worked on this program with their therapist. And we hope that you will still learn something new that you can take to your therapist. And for those of you who haven't been through the program, hopefully this will help to spark some interest for you in wanting to obtain this treatment. So let's take a moment to talk about how LSVT BIG is actually used to improve function with those fine motor tasks. Well, one of the words you've probably been hearing me throw around a lot is intensive. And we really do mean intensive. It means we are really working people hard. We are doing a number of repetitions. We are helping to motivate you. We are helping you to understand what you're doing and why it's going to help you. And we do this through really helping to increase that amplitude of those finger movements and really getting you to be much more aware of how your hand is positioning. You know, when you go to perhaps reach for a glass that's on the table in front of you, is your hand in a closed position and kind of down and very slow? And then when you go to open it, sometimes maybe you might knock the glass over or you don't correctly reach for something. You know, we take a look at that and we say to you, you know what? Let's see if we can get you to focus on sitting up in a taller posture and really having that hand in a nice big open position so that you see that hand reaching out for the glass in a big way. And eventually helping you to feel that the effort and the bigness that you're using is actually normal and what you need to be doing, and that's going to help you to function better. We also focus, like I said before, on functional task-specific practice. So again, whatever the difficulty that you're having, putting on makeup, typing, tying your shoes, whatever those fine motor tasks are, we're going to practice those with you. Of course, we wouldn't be good therapists if we weren't also giving you home exercises to practice. So not only what you do in the clinic is important, but it's probably even more important that you continue to do what we teach you at home as well. And then on top of that, we like to give you daily carryover assignments. And those are little assignments that we give to you at the end of each session where you get to go out in the real world and practice a task that we give you. So I may say to someone at the end of class, you know, what are you doing today, Helen, when we're done here? And she may say to me, well, you know what? I actually have to go home and I'm going to be sewing some masks because it seems like everybody needs more masks these days. So then I say to Helen, you know what? When you're sitting at the sewing machine, I want you to sit up with really big posture. And when you are kind of threading that material underneath the needle, I want you to make sure that your hands are open nice and big and that you're giving it a nice big pull. And then I'm going to ask Helen to report back to me the next day how she thinks she felt, if her spouse was there and he noticed anything, and how those masks actually came out. So again, taking everything back to that functionality. So our mode is really, like I said, not only that intensity, but that high effort. We as the therapist are really pushing you hard so that we get you to push back just as hard. And it means that we have to be really intense across all of the things that we do. So we see you 4 consecutive days a week for 4 weeks. We see you for a full hour, and we see you one-on-one. It's individualized therapy. We don't perform this with a group of people. So you are getting that full attention of that therapist. And as I mentioned before, we give you daily homework practice and those daily carryover exercises, which means that that whole time you're seeing us, really for all 30 days of that month, we're helping you to drive the understanding of making big effort and big movements really a lifelong habit and something that you're going to practice forever, because we know we're going to live with the Parkinson's disease forever. So we have to have a way to manage it. So this is what a full LSVT BIG treatment session looks like. You can see on the left-hand side of your screen, we have something called maximal daily exercises. We have 7 of these exercises. And I always like to say to everybody, these exercises are very, very important, but they're not the be all and the end all of our program. We're looking more to how do we make you function better. The exercises are a way for us to warm you up, to stimulate your system, and to really teach you how to make these big movements and to feel safe with them. So they're essentially our stepping stones. So we could say to you when we do a certain exercise where perhaps we're swinging the arm up really high, Julia and I could say to you, you know what, when you go into the cabinet, and I remember you telling me you were having a difficult time with reaching to get those towels off of that cabinet, remember the effort and the bigness that you gave me when we were doing that exercise? That's the same thing I want you to do when you reach into the cabinet. So we start with those exercises kind of as our touchstones to do things. And then we move into things called functional component tasks. And again, those are things that you are having difficulty with, things that you may have slowed down on, things that you don't want to lose the ability to do. And that could be anything from, again, reaching into your pocket, reaching into a cabinet, doing the keys on your phone. You help us to identify those things. One of the things that we always do assign to everyone, though, is sit to stand. So that's going to be one of them. And then we work with you on the remaining 4. Then we move on to our hierarchy exercises. And again, we use that term exercise in quotes because it's really just a functional task. These are functional things that you might, again, be having a challenge with or don't want to lose the ability to do. So things like getting out of bed, perhaps you want to be able to get out and play some golf, getting in and out of the car. It could be whatever the challenge is, and we will work with you, starting out mild and small, giving you lots of help, and then building it up over the course of those 4 weeks so that we make it much more challenging for you. And I always say to my folks when they come into therapy, I'm trying to make it so challenging here for you in therapy that you couldn't possibly find something harder out there. I want to prepare you for what the real world is going to hand to you. And then again, we give you the homework, which is going to include all of the daily exercises. We have you do those 5 functional component tasks again. And then again, we work on walking because walking is something that also needs to be within this system. And for those of you who use an assisted device, or even for those of you who may use a wheelchair, we still are working on mobility. So however we can help you to get from point A to point B, we want to do that for you. So I mentioned this before, think of those exercises as the building blocks. That's our start. We warm you up, we get you built up, we get you to feel what it feels like to be safe doing these big movements, and then we get you to use those large amplitude movements in functional ways that are important to you. They are particular just to you, that we don't pick the same ones for all people. This is something that you work on individually with your therapist. And our goal throughout all of this is a word called calibration. And calibration basically means we want you to be able to understand the mismatch between how you perceive your movement and how others perceive it. So a lot of times when we first start working with people and we get them to take bigger steps, we get them to stand taller, we get them to swing their arms, people will say to us, I can't walk like that. People are going to think I'm crazy. This looks ridiculous. When really all we've done is move them up to a natural amount of movement. People with Parkinson's have a motor sensory disconnect. So again, the body and the mind are they're not playing well together. The brain is saying, oh, these movements are okay, we get used to it. And then when we train you in these bigger movements that are actually normal movements, the brain has a little trouble with it again. So it's really the goal of LSVT BIG to address that mismatch and to get rid of it so that you can understand, oh, this is what it's like to have that normal quality of movement. This is how big I need to move to be able to do the things that I want to do. So that's really our goal, for you to feel calibrated and understand the quality of your movement. So I just want to leave you, before I pass this on to Julia, with what the 7 exercises look like. These are just snapshots in time. You can see that the first 2 are seated and then the next 5 are standing. That's the general way we perform most of them. We absolutely can adapt these exercises, though, for individuals who need to hold on to something. We can adapt them for people who need to sit, and we can also adapt them for people who are in bed most of the time. What I want to point out to you, though, is look at the big posture. Look at the big openness of the hands. Look at the size of the spread of how the feet are and how she's really working to kind of stretch everything to the furthest ability that she can. So we're working on extension, we're working on rotation, and we're really working on movements that really do combat the pulling in and rounding in of people with Parkinson's disease. So now what I'm going to do is I'm going to switch this over to Julia, and she's going to take you through the second half of the course.
Thanks, Heather. Great job. Great setup. Thank you again, everybody, for joining us. So as Heather has, really laid out the work so well, you can see where there's a great amount of research and also our understanding of LSVT BIG, of how this can really support fine motor. And I'm going to get in a little bit more into how we address the use of the hands and really work on this specifically. If you were to come in to see us and your goals were around improving your fine motor skills. So one of these is definitely these big hands. You see the lady here's got her hands really open, the fingers are really spread. And what that does, for most of you, if you are having some fine motor difficulty, you might notice your hand starts to stay more closed. There's 3 places that our fingers bend, and one is the joint where the finger connects to the hand. But then we've got that little joint, in the middle of the finger, and then we also have the joint at the end of the finger before it gets to the tip. And what tends to happen with the small movements that we see with Parkinson's is you guys start to bend more just at that big joint where your finger connects to your hand, and we call that a raking grasp. And that doesn't have the dexterity in it, right? That being able to move all of those little joints and really coordinate those does. So we're really focusing on the positioning and posture of the hand. So working on opening that up, really getting all of those muscles very active. And one way that we do this is what are called hand flicks. And so in hand flicks, we're really working to, it's almost as if you're gonna, flick water off your hands if you just wash them. We might all be doing a lot of that right now with all of our hand washing, but it's just a way to engage and really open up and activate the hand. So we're gonna take a look on this next slide at a video of what the flicks look like.
Okay, everyone, give me just a moment. I'm going to switch out of this and go into the video for you.
Thanks, Heather. She's like the whiz behind the screen.
Hand flicks, and you see a close-up here of Jenny doing hand flicks, and really pay attention to how she has her entire hand flick open. The second way to do flicks is to do an arm flick. Now you'll see a close-up of Jenny doing the arm flicks, and in addition to the fingers, we've added the movement of the arm to add some additional amplitude. Now watch as Jenny adds flicks to the floor to ceiling exercise. So we have our big to the floor, up, and in the sustained position, she flicks her fingers open 10 times, keeping that big posture, but flicking big with the fingers, and then ending big.
Okay, all right, let me get you back to the main screen.
Thanks, Heath. So you could see where we can add those flicks into the exercises, right? And really work on that engagement and strengthening through the hands.
Sorry about that.
No problem. But then we can also take those flicks and transfer those as we start to work into some of the functional things. Because the goal, just as Heather mentioned earlier, is, the exercises are just that building block to really getting you to be able to participate in and do the things that are meaningful to you, the things that you enjoy. because we know if we make it meaningful, it's going to motivate you to continually practice those exercises and really do your home exercise program. It helps to really make that link. You know, I had a gentleman a while ago, and I was a little concerned about how compliant he was going to be with his exercise program. He wasn't much of an exerciser, but one of the first things that he mentioned was he wanted to be able to cut his steak on his own. And within the first week, I got him to where he could cut his steak on his own, and I had him hooked. So I had no problem getting him to do his exercises because he had that buy-in. All right, so we really want to make sure, though, I want to, be really clear that these should be personalized to you and they're purposeful to what you would like to do. So for example, you might come in and let's say you fill out your intake forms and I notice your handwriting looks a little small, or maybe it's a little illegible. And I say to you, is handwriting something that you would like to improve and like to work on? And you're like, not so much. What's really more important to me is I want to be able to button my shirt or put my socks on or get back out in the garden. Then those are the things that we're going to work on. So it's not what's meaningful to me. It's truly what is meaningful and purposeful to you. That's what we're going to practice. And just like Heather showed in that research slide earlier, we even have research to back up that when we have you set goals, what would you like to be able to do? And we practice those specific tasks. You're going to not only be able to do those things more independently, hopefully, but also improve your arm and hand function as well. So what is a functional component task? Heather showed that slide earlier, then on the left-hand side of the screen showed how you were doing all the exercises, but then on the right-hand side, we had those 5 everyday tasks, right? So we want to think of these as things that you do every day, and we're going to practice those 5 times each. So it's something that's simple, right? Kind of a one-step type movement. Some examples that we see often are retrieving something from your pocket. That's one I get a lot, either getting the wallet out of the pocket or the keys. Sometimes it's putting jewelry on, as Heather mentioned earlier, hooking your watch, but fastening your belt, buttoning a button. So it's something that's really simple, selected by you and personalized to you, and it's never going to change. So over those 4 weeks, we're going to continue to practice that. But here's the caveat. We might be practicing it repetitively, but we're going to continue to bring the intensity. So Heather used that word a lot. So what does that mean? That's not always just doing it harder necessarily, or in a way that, is maybe with more force, but it also can just be those real world challenges. So let's say that, you're somebody who maybe is taking more time to get ready and you're used to your spouse, maybe, come on, honey, we've got to go, we've got to, get out the door. Then we're going to throw some of those cognitive dual tasks at you. I might be kind of prompting you that way while you're trying to button it. We might have you standing on a balance pad or sitting edge of bed in a way that maybe your balance is challenged. So whatever we feel are going to be the challenges that come your way and might act as a barrier or make it harder for you to do that task, we're going to add that intensity as well. So it might be repetitive, but it never gets old or boring. So let's take a look at buttoning and how we approach that. This is a really common one that we see of people having difficulty, especially with small buttons on shirts or on the collar of a button down. So let's take a look at our approach to that. Just give a minute for the video to load.
Sorry about that, guys. Hang on one moment.
There we go.
You're watching Bob do his buttons. It's a really slow, small kind of movement that he's using to try and get those buttons through the buttonhole.
This one took struggle.
And this can be a very frustrating thing for a lot of people, Bob. You're not alone in that.
Let me try again, folks. We're having a little slowness here. Let me see if I can bring it up. And I think we got it.
Good. And I want you to just kind of notice as you're watching Bob do his buttons, it's a very slow, small kind of movement that he's using to try and get those buttons through the buttonhole. Now, this can be a very frustrating thing for a lot of people, Bob. You're not alone in that. Does the top button tend to be one of the hardest ones for you? Okay. All right. Let's do it. Ready? 1, 2, 3. Go again.
Wow.
Really pushing it hard. Nice.
About a third of the time.
You're right. Good job.
So hopefully you were able to see there how it started out. His movements were really small. It was very awkward trying to manipulate that button into the hole. It's definitely some frustration that was going on. I'm sure there's some of you out there that can probably relate to that. You notice how we added those hand flicks in. Jenny cued for him to flick the hands and make the movements bigger. And even just that really improved the time and efficiency that he was able to get his shirt buttoned. So then what about a hierarchy task? We're going to kind of switch gears here because this is the other part of the program that we work on. So this just refers to tasks that are more complex. So they're things that have multi-steps. So, you know, an example would be rather than just buttoning your shirt, maybe it's actually putting your shirt on. So having to thread the arms into the sleeves and, you know, get all of the buttons buttoned and tuck the shirt into your pants and maybe straighten it. So it's something that's going to have more steps and take a little bit longer. But still, it's always going to be meaningful to you. That is the most important part. And how we're going to determine that is discussing your goals. So if you come in and you're seeing a physical or occupational therapist, we're going to be asking you, you know, what do you want to do better? What have you lost the ability to do, or what do you not want to lose the ability to do? And then that's what we're going to make your functional components and your hierarchy task. We kind of tease out which ones are simple, which ones are more complex, so we can make it a really complete program. So then what is a carryover assignment? Heather referred to that earlier. And so if we could just go, oh yeah, there we go. Carryover assignments. Got a little ahead of the game here. So those are those daily assignments that Heather mentioned that you're going to get all 30 days. So if you come in to see us, just like she mentioned, we're going to ask you, you know, what are you up to today? Maybe it's, you know, like she said, sewing those masks, or maybe you're going to be doing some distract baking. I've been doing that a lot myself lately, or, you know, cooking. And we're going to give you something that fits into your plan for the day that you have to practice big, because we really want it to be not about performing for us when you come into the clinic and just doing your movements big there. We want you to start to notice when you're in your daily routine, when you're in your home doing the things that you need to do just to kind of live and function, how to make those bigger movements, make things more efficient and easier for you. So we're going to mandate those specific tasks, and we're going to ask that you get feedback either from someone else. Maybe your wife says, wow, you know, you got your shirt on in half the time that you usually do. Or maybe it's you notice it. You know, I was able to do this more efficiently or more easily. And we're also going to progress the difficulty of those. There's that intensity piece again over the 4 weeks. So it might start out that it's just doing one very simple thing, like a big reach to open a door when you're leaving our clinic. And then maybe by the end of the week, it's a big walk to that door, a big wide base of support when you're standing, big reach, and maybe opening the door even for someone else. So we're going to make whatever those different tasks are more complex, more challenging, more real world. So let's give some examples here. These are some things that might be given as carryover assignments. So if you're thinking about that progression, you know, week 1, maybe we're looking at just picking up a pill bottle big, picking up the pills big, or sorting the pills, picking up a fork in a big way, or buckling your belt in a big way. Week 2, it might be that you're putting dishes away and using a big grasp, you know, using button your whole shirt. So rather than just one button, maybe we're really getting into the whole shirt and the cuffs. Maybe it's clipping your nails big. By the time we get to week 3, you notice the tasks are getting a little bit more complex, like tying a necktie or changing a light bulb, writing a letter to someone, while you're also thinking about your posture and your big hand movements too. By week 4, we might really be getting into a lot of elements so that you're using a big grasp to reach for items when you're in the grocery store. You're using big manipulation of your fingers to get your money or your card from your wallet, a big reach and grasp when you even go home and start to put those groceries away. So we want to make sure that all of these things are taking the elements that we've taught you through the exercises and that you've worked and practiced so hard and really putting them into your daily function. So some anecdotal reports that we hear, because we do see great outcomes and, you know, scores change and people are walking better, moving better, or some of the fine motor tasks and tests that I do where I look at your speed and taking pegs out of holes, you know, as an outcome measure, we see those get better. But here's the thing, these are the ones that are most important, the things that you come in wanting to do that you improve on. So we've had people that had maybe stopped playing the piano or the guitar, or maybe were playing less and they take up those hobbies again. That makes our day. Turning pages in a book. I've even had people that were starting to get frustrated with reading because that had become so difficult. Dealing and shuffling cards, because card games have, you know, not only a fine motor benefit, but also there's a lot of cognitive benefit to that as well. Getting your money, your bills, your coins, your cards out of your wallet, being able to count change for customers, you know, looking for items in your purse. One of my favorite things to do as a therapist are what I call purse interventions for ladies. And so we organize it and work on grasp and manipulation and really making it where it's easy and efficient to do that. And then even picking up a sewing needle or a pin to do any type of needlework or sewing. So in summary, just to kind of put it all together, we know that these fine motor control difficulties are very common in Parkinson's disease, and the spread of effects is that they can make it really difficult for you to perform your activities of daily living. That's what we mean by ADLs, and even your instrumental activities of daily living. So meal preparation, you know, cooking, shopping, you know, all the things that you need to do for your home management. And there is a good deal of research that's related to how we approach effective treatment and interventions for fine motor control issues. So when you come in, we know that we're using this body of evidence to really support how we approach what you're doing. So you're going to get the best of everything that we can give you based on the research and based on what we know is effective and works. And LSVT BIG is one treatment which can help to really increase your independence, help with that speed, make you more efficient, and even improve the quality of your fine motor task that you need just in your daily life. So how do you get started with LSVT BIG and LSVT Loud? Well, you do need a prescription. So you will need a referral and a prescription for speech and or physical and occupational therapy. So if you want to do Loud, that is our sister program that works on your vocal volume. So you would need a referral for a speech language pathologist. If you want to do BIG, that's going to be delivered by either a physical or occupational therapist, and they need to write the script so that you are able to be evaluated by us and treated. If you go to our website, lsvtglobal.com, you can go to the Find an LSVT Loud or Big Certified Clinician, and you just push on the button. It does ask you some things like the mile radius that you want to put in, and it'll give you a list of people that are in your area that can deliver this treatment. There are also some videos. We do recommend that you go through the program with a therapist first, because I'm sure we all know, just like right now, you know, I am working out with some of the trainers I was going to classes with in the gym, but I don't push myself quite as hard when I'm just doing it on video like I was doing when I'm actually in person. So these videos are there for those of you, I think about half of you have done the program before, and maybe you want to get back into it. Those of you who haven't done the program, I would definitely recommend that you try to get, you know, treatment with a therapist first and then use this for support later. You can also download and stream the homework helper videos. At this time, they're discounted due to COVID-19. So the download is $17 for a year. Of streaming is only $9. So this is included in those videos. So you can find that on our website. All right, so then also to know we're here for you. You know, I really consider all of my clients I've worked with, and even this community, as my people. It's like you guys are our family. So daily exercise is so important. We've got those videos for you to purchase or download. There are also group exercise options, so you can find a Loud for Life or a Big for Life class. Right now, we've been doing Tele-Loud for Life and Tele-Big online. So you can join us. That's a lot of fun. So that's going to be at this time, we know, through April and May on Fridays and possibly beyond that. So you can go to info@lsvtglobal.com. You can email us and we can give you more information. It's really important to remember too that you might need a tune-up every 3 to 12 months. So some of you that have done big, it might be time, just like you go to your dentist and get your checkup, to come back in and see us and get a little tune-up. And then also remember too, there's all kinds of fitness out there for Parkinson's, and there's a lot of programs online. So check those out as well. Keep moving. So some opportunities to learn more from us. We have monthly webinars on different topics. We have an on-demand webinar library that's archived that you can watch and listen to, and see if there's some areas of topics that you're interested in. There's a patient and family section on our website. We also have featured blog articles, some testimonials and videos if you want to kind of shop a little bit more and see what it's all about. We have live seminars online. There's a global Facebook page, and you can always ask our experts. We're here to help you. So all of this is located at lsvtglobal.com. So where are the other places that you can learn more about Parkinson's and also find some great webinars and resources at this time? There's the Parkinson's Foundation, the APDA or American Parkinson's Disease Foundation, Michael J. Fox, Davis Finney Foundation, and then also the World Parkinson Coalition. So if you're looking for more webinars or exercise options or different things that you can participate in, I would check out all of these resources. So here's a great testimonial we'll finish with. This was a gentleman who did big, and he talks about how there were activities that he had been avoiding. So getting up from a low couch, getting in and out of a car, and his was low to the ground, getting his bills in and out of a wallet, and getting his phone out of his pocket, and even getting his sports jacket on and buttoning a shirt. So all of those he came in really avoiding, and after 4 weeks, he was able to improve upon all of those things and make them part of his normal routine. So with that, I'm going to hand it back over to Heather to act as the maestro of questions.
Great, thank you so much, Julia. So much wonderful information about what people can do and what resources are out there for them. So we'd like to encourage you to take some moment to ask us some questions. What you want to do is go ahead down in the question box on your control panel. You can see it's labeled questions. Go ahead and type your questions in there for us. I'll read that question out loud, and then Julia or myself will answer that for you. If you really prefer and you want to have the world hear you, you can raise your hand, click on the little hand icon. I'll call your name out, we'll unmute you, and then you can ask your question out loud. If you think of a question after we've already concluded this webinar, or maybe we run out of time, you can always get in touch with us at info@lsvtglobal.com at any time. Those questions can have absolutely nothing to do with today's webinar, or they could have everything to do with it. So just know that we are here to help you. So let me go ahead and jump into this question box. Question here says, is this the plan you offer your patients? And I'm going to just read into this question, and I apologize, Thomas, if this is incorrect, so you can retype in your question. When patients are offered the LSVT BIG program, what Julia and I talked about today is the full program with the exercises, the functional component tasks, the hierarchy, doing the walking, doing the carryover assignments. Everything that we talked about here is part of the full program. So if someone is appropriate for the program, we certainly do offer this program for them. We are getting an aloha on here. Julia, we know who our Hawaiian friend is. She's thanking us so much for this webinar. And aloha back to you,
Hi,
Mike.
lady.
We hope to see you. Someone else wants to know, will this be available as a recording later? It's wonderful to view this from the perspective of what you would say to instruct a potential patient. Yes, absolutely. If you want to log back in, we do have webinars on demand. So that will be, give us a couple days to have that uploaded onto the website, and just go on to lsvtglobal.com. Could you show the shirt buttoning video again? I certainly can, and I apologize. All this technology is kind of making our eyes go a little buggy and cross, so I apologize. Not on my A game with that. Let me see if I can get that to come back up. I'll go through the rest of the questions, and then I will show that buttoning video again for you. Let's go with this one. Thank you so much for the information. Appreciate that. Julia, I'm going to give you this next one. Hi, I wanted to know, does this also help to reduce hand tremors?
That's a really good question. So here's the thing with tremor. It really depends if it's a resting tremor or an action tremor. In people that I've worked with that have a resting tremor, just meaning that if your hand is, sitting in your lap or in a position where it's not active and you have a little bit of that pill rolling tremor or a little tremor, when you activate the hand typically or really engage it, a lot of times that tremor subsides. Now in people that more have an action tremor, so when you go to reach for something or you go to do something with your hand, that's really when your tremor initiates. It doesn't help so much with that. But I have seen some people, definitely with the resting tremor, that they felt that it got better. There is some evidence too with essential tremor, which is more of an action tremor, that doing some exercise and things sometimes helps reduce tremor for people. So I could see where possibly, I more get people with a resting tremor, and that's where I've seen it to be effective. But great question. And tremor is like, we have a saying in our clinic that no two snowflakes are alike, and neither are people with Parkinson's. So without knowing your tremor and kind of your triggers and what it looks like, I definitely wouldn't want to give you a definitive answer. So I'm sorry if I'm being too general.
Great, thanks so much, Julia. I'm going to take this next one here. This actually comes to us from an OT student. Thank you. And Julia, if I don't answer everything correctly, please jump in. She wants to know, what type of setting would you use LSVT BIG in? i.e., do you see this more as a home care setting, outpatient? The answer is it can be used in all settings. We say that with a caveat, though, for people who are in acute care, obviously, people may be too fragile at that point to actually do this program, and probably not spending that much time in the hospital. But you can absolutely talk to people and help people get set up for possibly moving on to it. It's used in the home care setting, it's used in outpatient, it's used in SNFs, it's used in rehabs. Really, it can be adapted into any setting. The other question is also, are the functional component tasks synonymous to blocked practice? And I guess you could kind of think about it as doing a blocked practice, really trying to get that person to do it over and over again the correct way. We do make it more challenging, though, so there is that change. And Julia, the question there also for hierarchy says, are the hierarchy tasks sort of synonymous to random practice? And I would guess to say yes, because we do start with smaller portions of it and change it around. But ultimately, that last week of the session, that client really is truly doing the full program of whatever that hierarchy is from start to finish in real life time and with lots of challenges. So great question. Thank you. Julie, I'm going to ping this one back to you. Could you share some of the techniques you utilize to address micrographia using LSVT BIG?
Oh, definitely. So that research article that Heather cited earlier, the NACRTS article, really talks about that intensive practice, right, in Amplitude. Another study that NACRTS had done looks at, they compared if people use smaller lined paper, so like college ruled versus larger or wider ruled, which is better. And surprise, the wider ruled, the bigger lines were better. So often what I'm working with as far as handwriting is I'll start people a lot of times kind of a blocked practice, like you were saying, of having bigger lines. Often too, I might get a pen that's a little bit bigger grasp, so not holding a really small pen to start with. I might work up to that. Using the flicks, kind of like you noticed in that buttoning video before initiating the task. There is a lot of support that can be gained too from arm support to start, so having them support the arm and working on, really trying to write each letter one at a time if you get people that kind of run the letters together. So often if people are having difficulty with cursive, I'll start with print and just practicing letters to start, working up to words, working into sentences. But it really depends on how, when you do your task analysis, where the impairment lies. Is it truly even in writing letters they're illegible, or is it more once they start to try to write a sentence or a paragraph, it breaks down? Because you want to kind of hit them where the difficulty starts. But those are some strategies that I use, and I definitely see success. But the key is, and this is what I always tell people, they have to do the practice. So that's where LSVT BIG is great, because then they're practicing that at home, consistently. Because if they think they're going to come in and work with you, maybe they're not doing BIG like one time a week and their handwriting magically get better. It just doesn't work that way. They've got to really put the time in and at least do a grocery list or write a card to a friend. They need to use it somehow every day or at least 5 days a week.
Great, thanks, Julia. And this one kind of dovetails off of that. They wanted to know, do you have any suggestions when you have folks who are suffering from comorbid structural issues in the hands, kind of like maybe perhaps rheumatoid arthritis? Any tips for that?
Well, definitely you want to still follow all the precautions that you would have. I think you do have to be a little careful then with those flicks if they have arthritis or some comorbidities. But you still would want to look at those precautions and think of that as a separate issue per se. But then your joint protection strategies still come in play of maybe building up the pen a little bit more. Maybe they need more stretching or rest breaks if the hand is kind of almost like a focal dystonia, getting some cramping when they're doing that activity. So yeah, I think you still want to use the same strategies, but maybe if you're dealing with another issue, they might need to, deal with that issue separately and have more rest and treat that as a separate condition.
Great, thanks, Julia. I'm going to take this last one here. We'll do one more question and then we'll go to the buttoning video. I feel like this philosophy is shared overall in occupational therapy. What sets it apart in terms of the carryover technique? So yes, the philosophy of what we're talking about should mesh with what you learn as an occupational therapist, that you are doing task analysis, that you are looking at the functionality of your patients, that you are looking to improve quality of life. I think what sets LSVT BIG apart is the research that we have behind it, supporting it, and the way that we lay it out in terms of really getting people to increase the amount of amplitude, increase the intensity, for people to really repetitively do it, for the way that we take the challenge up, the way that it's all set up there, and how it really does kind of attack those underlying problems that people have, that motor sensory disconnect, as well as the bradykinesia and the hypokinesia. So lots of research that's great that's out there. If you wanted to take a look you could perhaps look at PubMed and see the research that we have backing that up. So thank you so much, everybody. You can please stick around if you'd like to see that video again. If not, you feel free to go. Do take a moment though to fill out our short survey, and let's see if we can get that video back up. Okay, just one moment, please. And let's see how this goes. All right, thank you so much, everyone. We hope that we will see you virtually sometime in the future on another webinar. Have a great day.
Thank you.